Hello everyone, my name is Nick Pratap and I'm the Clinical Exercise Physiologist here in the PCSC program. Today I'm going to be talking with you about exercise and how it relates to prostate cancer patients. Now from the physicians and staff of the Vancouver Prostate Center, we'd like to say welcome. Support for this initiative has been provided from a number of government and non-government organizations. We're also very grateful for the philanthropic donations made by the individuals to this program. Our program is designed to provide supportive care for both patients and their partners from the time of diagnosis onwards. This is both a supportive care program and a research initiative, a set of modules or programs that provide supportive care beyond treating the cancer itself. Most modules in the program include preemptive and educational themes. So patients choose modules of interest. We believe that knowledge is empowering, and educational sessions like this one can help answer any questions that a patient may have and also help relieve any stress that they may be feeling. Now on the slide, you can see a set of all the modules that are found in our program. Module number 1 is the introduction to prostate cancer and primary treatment options. So a nice overview of prostate cancer and the various treatments themselves. Option number 2, or module number 2 rather, is managing the impact of prostate cancer treatments on sexual function and intimacy. So if you're having any concerns around sexual function, erectile dysfunction, that'd be a great module for you to look into. Module number 3, which is today's module, exercise for prostate cancer patients. We're going to spend some time talking about that today. Module number 4 is recognition and management of treatment-related side effects of androgen deprivation therapy, or ADT. So if you are someone that is planning to have ADT treatment or are currently going through ADT treatment and potentially experiencing side effects, that would be a great module for you to check out. Module number 5 is the pelvic floor module. So if you're experiencing any incontinence, that would be a great module for you to attend. Module number 6 is our counseling services. If you're dealing with any issues regarding psychosocial help, maybe dealing with some stress, anxiety, working with our counselor in the program would be quite beneficial for you. Module number 7 is the metastatic disease management module. So if you have bone metastases develop, this would be a great module for you to attend. And finally, module number 8 is the nutrition module. So if you have any questions surrounding nutrition, diet, healthy ways of eating for prostate cancer patients, that would be the best module for you to go to. Now today, obviously, everyone's here to learn a bit more about exercise and how it can help prostate cancer patients. So this is a general discussion, right? We're going to be doing an overview of exercise, but you got to remember, I don't know you as an individual. I'm going to be going over the general guidelines of cardio, about strength training, but I don't know you as a person. I don't know your medical background. I don't know any pre-existing issues you may have, and I don't know the specific types of prostate cancer treatments you've been through. So if after today's presentation, you feel like you got the information you needed, great. But if you feel like you need a little bit more one-on-one support, then I would highly recommend booking a one-on-one consultation with one of the exercise physiologists in our clinic. Okay, so with the one-on-one visits, basically you sit down with myself or one of my colleagues, and we essentially go over your goals. We'll go over your medical history. We'll take you through a few exercise tests. We'll also go ahead and put an exercise plan together for you. Okay, then we let you go off and do the exercise, follow up in a month. After that 1 month follow-up, we go ahead and restructure anything we need to in the exercise plan. Then we follow up again at the 3-month mark, the 6-month mark, and then finally the 1-year mark. Okay, and then obviously the goal after each one of these sessions is to make sure that we're improving from an exercise standpoint and address any questions or concerns you may have as a patient. Now in today's presentation, we're going to cover various topics. What is exercise? Why you should exercise? How much exercise is recommended? We're going to talk about specific exercises to manage treatment-related side effects, how to enhance health and long-term survival with exercise, and how to get started safely. Let's jump right into it. What is exercise? So there's a couple things I want to go over in this slide. The first thing I actually want to start off is what is physical activity, okay? So physical activity can be defined essentially as any movement, okay? Me just starting to walk around right now, you getting up off of your chair and walking around, that would be considered physical activity. Gardening, walking your dog, vacuuming your house, anything that goes from a position of rest to a position of moving, okay? Or a position of being stationary to locomotion, all right? The difference between physical activity and exercise lies around the structure, okay? So you can see a nice definition of exercise there. Exercise is defined as any planned, structured, repetitive, and intentional movement performed to improve or maintain one's physical health. Okay? So, for example, if you were wanting to increase arm strength, you're not going to do that by vacuuming or going for a walk, right? We need to be very intentional about that. In order to improve arm strength, we need to do exercises like a bicep curl to actually enhance and improve arm strength. Same thing with improving your cardiorespiratory capacity. You're not going to do that by just going for a walk once a week for 10 minutes, right? Maybe as a starting point, yes, but eventually that once a week needs to turn to, okay, I need to go for a walk 3 times a week for 30 minutes, and eventually up that to 5 times a week for 30 minutes to really start improving your cardio. Same thing with the arm, right? You can't just do this once a week. It has to be, okay, I want to do a bicep exercise using a specific weight. Maybe I got to do that 3 times a week, okay? So the big difference here is physical activity is any movement, exercise is intentional, it's usually goal-oriented, and there's usually an outcome at the end of that, okay? And then lastly, we have sedentary behavior, which is what we're trying to move away from. So sedentary behavior essentially is not doing any movement, right? So if you're watching this right now, you're just sitting in front of a computer screen. Maybe at work, you're spending a lot of time in front of a desk. Maybe after work, you're coming home, spending a lot of time in front of a television or reading. And so you might have heard of this term before, but sedentary behavior is becoming like the new smoking. And so we are slowly trying to move away from that because there are a lot of health risks and negative health impacts that come from that. Let's dive into that a little bit more. When it comes to sedentary behavior, we know that it's associated with an elevated risk of all-cause and cardiovascular mortality, cancer, type 2 diabetes, and cardiovascular disease. Okay, so the major diseases, if not more of them, the risk of all of those end up going up by just not moving. Okay, so I wanted to go over an example here with you. So we have 2 individuals here. The one in red, we'll call her Sarah, and then the individual in the green, we'll call him Mike. Okay, so let's go through their day here. So Sarah wakes up in the morning, has breakfast, gets in her car. She has a 45-minute drive to work, gets to work, and all throughout the day, she's at her desk. Okay, maybe the odd time to go grab some water, use the bathroom. She might walk around a little bit. Once work is done, she's back in her car, about an hour back home with traffic, and she gets home. Ellen DeGeneres is on that night, so she's watching TV, goes to bed. Realistically, how much, not even exercise, but how much physical activity has Sarah done that day? Not a whole lot, right? I mean, other than maybe moving to her car or walking to and from her car rather, maybe, a couple walks at lunch, that's about it. On the flip side, let's look at Mike. So Mike is lucky enough to live about 20 minutes away from work. Okay, so Mike walks to work. He sits down at his desk. He has a computer job as well. But Mike attended one of my talks, all right? And so he remembered, he's like, okay, well, Nick said I got to add in these exercise snacks or breaks. So every hour, Mike gets up and does some sort of movement, right? Whether it's going over and talking to his colleague, whether it's, going and using the bathroom, anything, okay? So lunchtime comes around, half of his lunch he's eating, the other half he's out going for a walk. At the end of the day, he walks home, he gets home, he goes for a quick 30-minute bike ride, makes dinner. After dinner, he's in his woodworking shop working on a project. And then just before bed, he takes his dog out for a walk. So you can see the night and day difference here. Sarah didn't have a whole lot of physical activity. Mike's adding a lot of those movements in, all right? And so what we're trying to promote here is something called an exercise snacks, or small bouts of exercise found throughout the day. And you might ask, well, Nick, why is this important? Why do I need to, do these small bits of exercise throughout the day? The body is very good at adapting what you put onto it, right? So if you're always sitting, your body's going to basically be like, hey, you're not using these muscles. Let's get rid of them, because muscle is very metabolically demanding tissue to keep alive, basically, all right? So you're going to start losing muscle mass. You're going to start becoming weaker. Not only that, your metabolism may start to slow down, and all those extra calories that you would have burned moving around, you're going to start storing right here, right in the belly, okay? And so if we start storing too much fat in the belly, that's when we start increasing our risk of just all diseases, okay? By adding in these small bits of movement throughout the day, we're going to be promoting that metabolism. We're going to be promoting blood circulation. I don't know about you, but if I find myself sitting for more than an hour, hour and a half, you get up, you feel very stiff. So injury risk starts to go down a little bit just the more you move up throughout the day. And not only that, but if we talk about the impact that it has on metabolic health, right? We just talked about how all those extra calories get stored in your belly. By just moving around, you'll be able to surely start working on just burning more calories more consistently throughout the day, which will have a positive impact on weight management, okay? We're going to touch on this a little bit more when we get to the fatigue slide regarding fatigue patients feel on ADT as well as radiation. But these exercise snacks are going to become very important for that demographic as well. Our recommendation then is we want to try to move more and sit less. So the more we can promote movement throughout the day, the better it's going to be for us. So what are some strategies around this? Well, if you find yourself sitting, maybe it's at work. A lot of us have Apple Watches now. They'll automatically time you to get up and move around, which is great. If you don't have one, maybe just setting a timer on your phone or looking up at the clock every hour on the hour. You can just get up, walk around for a few minutes. You can consider doing a sit to stand from your chair, maybe going over to a wall and doing 10 push-ups. If you're in front of a TV, I like to promote patients getting up every commercial break, right? Same thing. You can go for a quick walk, 10 sit to stands from your chair. Maybe consider putting the remote up by the TV. So if you do need to, or if you do want to change the channels rather, you got to get up, grab the remote, change the channel, and then come sit down. Okay, so a lot of different strategies that you can implement when it comes to trying to add more movement throughout your day. Another question I get a lot is, well, Nick, I'm here, my oncologist, my GP, they referred me to come here, but why the heck do I even need to exercise, right? So it's a good question. We know that the leading cause of death in men with prostate cancer is actually cardiovascular disease, okay? So if we're able to, diagnose prostate cancer relatively quickly, and through all the research that's been happening over the course of the last 15, 20 years, long-term prognosis for prostate cancer patients actually look really good. Out here, especially in Western culture, because of our diet, because of our lack of movement, unfortunately, obesity is on the rise. It's cardiovascular disease that is causing an issue for many individuals, okay? And so if we can promote more movement, it's that movement that can significantly reduce your risk of developing cardiovascular disease, as well as managing a lot of the risk factors around it. Exercise can reduce and manage the adverse side effects of prostate cancer-related treatments, which we're going to talk a lot more about in the coming slides. Exercise has a positive effect on metabolic health, specifically increased cardiovascular fitness and reduced whole body fat mass as well as blood pressure. So earlier I just mentioned how we want to try to control some of the risk factors for heart disease, which include high sugar levels, high cholesterol, high blood pressure. Exercise can help manage all of those. Exercise can help lower all-cause mortality, which was observed in older adults doing aerobic and weightlifting exercises. So the lowest mortality risk was actually seen among adults who did a combination of both. So if we can get you on a good plan for both resistance training and aerobic exercise, we can see a significant reduction in mortality risk. And lastly, exercise is the most effective and evidence-based non-pharmaceutical intervention for prostate cancer patients. So I always joke around with patients here, but I'll be like, with a show of hands, how many of you like taking more medication, right? No one's hand in the room is going up, because if you have to take less drugs, obviously you don't want to, right? So if you're looking for that magic pill, exercise is absolutely it, okay? But it can't just be, okay, I'm going to do this for 1 day or 1 month, or, when my prostate cancer treatments are done, that's it. This has to slowly start becoming a lifestyle change and modifications, because we're going to see how many benefits it has, not only for prostate cancer patients, but for just general well-being. And actually, this slide sums it up really well. Exercise has been shown to improve cardiovascular health, bone density, which we're going to talk a lot more about with ADT treatment patients, cancer-related fatigue, bladder incontinence, sleep, right? We burn more energy throughout the day. We tend to sleep better. Sexual function, muscle mass, and strength. Again, going to be very important for patients receiving hormone treatment. Body composition, right? We just talked about how increasing your belly size can lead to the development of cardiovascular disease. So we really want to put a significant focus on controlling how much fat mass we have on our body. Blood sugar control, right? I've worked with many patients that are in the kind of that pre-diabetic zone, and their doctor's like, well, I'll give you some time to do some exercise and lifestyle changes. Let's see if you can avoid having to go on another medication. A lot of times we put you on a good strength training routine, do some exercising, you can avoid having to use those meds. Maintaining a healthy weight, flexibility and balance. And lastly, it has a really good proven track record on improving one's mental health. You're stressed out, go for a walk or try doing some hard exercise. A lot of the times you come home and you're generally feeling a lot better. The next question is, how much exercise is recommended? We're going to go through 4 pillars of exercise here, and each of these do have their own credence and their own generalized amount of time we want to be dedicating to them, and we're going to specifically touch on each, okay? So we're going to talk about aerobic exercise, resistance training, flexibility and balance, But before we do, I just want you to, take a minute and ask yourself a couple of these questions. And again, we're going to review these as we go along. As exercise physiologists, we like using this FIT principle to prescribe exercise. The F stands for frequency. And again, ask yourself these questions. How often are you currently exercising? Are you going for a walk once a week? Maybe swimming once a week? Is it every day? Intensity, how hard do you push yourself? Do you consider you going for a light walk hard enough? Are you all out of breath when you're doing your exercise? Time, how much time do you spend? Do you do 2 minutes a day? Do you do 10 minutes a day every day? Do you do an hour a day, 5 days a week? And lastly, type. What modes of exercise do you do? Do you consider gardening exercise? Do you consider going for a walk exercise? Do you consider dancing exercise? So all points we're going to touch on coming up here in the next couple slides. Let's talk first about aerobic exercise. When you think aerobic exercise, what do you think of? Maybe the first thing that comes to mind is going for a walk, using a treadmill, swimming, running, cycling, all great examples, right, of aerobic exercise. Through Health Canada, our goal is to accumulate at least 150 minutes of moderate to vigorous aerobic exercise a week. Now, I'm going to define moderate and vigorous in a couple slides here. But 150 minutes, you look at that number and you're like, that is a big number to accumulate, right? And so let's take that and let's break that down a little bit. So 150 minutes can be broken down to 30 minutes a day, 5 days a week. We can break that down even further. You take that 30 minutes, you can break that down into 3 10-minute bouts 3 times a day. So that can mean 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening. So our goal then is to try to accumulate at least 30 minutes of aerobic exercise at the end of the day, most days of the week. And if that means, starting with 5-minute walks at a time and gradually building up from there, that's totally fine. But ideally, our main target should be most days of the week for at least 30 minutes. If you're doing more, if you're already doing that, great, continue on with it. Resistance training. Okay, we think resistance training, first thing that comes to mind, lifting weights in the gym, right? Iron, barbells, dumbbells, resistance band, TRX, kettlebells, all great examples of resistance training exercises. So when it comes to resistance training, we want to focus on the major muscles of the body. This includes the chest, the shoulders, the core, the back, the legs. Ideally, we want to try to get at least 2 sessions a week. And we're going to talk a little bit more about repetitions, sets, again, in a couple slides here. But when it comes to resistance training, we know that we generally peak strength at about 30 years old, okay? Every decade after that, we slowly start to reduce in strength and muscle mass. Now, it doesn't happen at a significantly quick or fast rate until we reach about 60-ish, 65, okay? Once we get to that age, we start to see this decline at a much quicker rate, and every decade after that, it declines even quicker. So it's gonna happen to you, it's gonna happen to me. We can't stop it, but one of the main things that we can focus on is how can we reduce that steep curve from going like this to, leveling off a little bit more so it goes down a little bit slower. And resistance training is absolutely going to help with that. The next section we focus on is flexibility. Again, I usually, throw this out to the audience. How many of you have ever dealt with some sort of a nagging injury, right? Neck pain, shoulder issues, back pain. I mean, I'd say 85% of hands generally go up. And so a lot of the times these injuries or nagging muscle ailments can be helped with performing some sort of a stretching routine, whether that's a formal stretching routine, whether that's doing some yoga. All these different types of exercises and mobility drills help open up the body so that you don't have that discomfort. You think stretching rather, you think, quite boring. But stretching is one of the main ways to not only reduce chances of injury, we know as we get older, that joint stiffness starts to increase, right? And so if we're trying to promote reducing that stiffness, stretching is one of the best ways to do that. The typical prescription when it comes to stretching or flexibility exercises is ideally you want to try doing it after a exercise routine or after a warm shower. Those are both great times because now your muscles are warm. It's easier to stretch them out, okay? Easier elasticity, and injury risk goes down. Now, I have had patients, Nick, I've been stretching first thing in the morning every day for the past 20 plus years. Is that wrong? Should I continue doing that? The answer is yeah, go ahead. I mean, for you, if you're not having any issues with injuries, if you've been able to do a routine like that for many years, then absolutely stick with it. If you're someone that's brand new, I wouldn't necessarily say that's the best place to start. I would much rather you stretch after a warm shower or after a exercise routine so that we can reduce that injury risk. So typically speaking, when it comes to flexibility, you can stretch every day of the week. Usually I promote at least 2 to 3 sets of roughly 30 seconds even upwards of 1 minute holds per stretch. And then lastly, balance. Balance exercise. We want to add balance every day. The old protocol was balance should be prescribed to any individual that's at risk of falling or any individual over the age of 65. I promote anyone and everyone should be doing balance. There's never an age group where balance should be excluded. We know that balance training has many benefits. Obviously, the older we get, we want to reduce the risk of having falls. Last thing you want to happen is have a fall, fracture a hip, and be bedbound for months on end, right? Because the recovery of that can be quite challenging. From a intervention side, if you're someone that's on hormone treatment, we're going to talk about this a little bit more, but your bone density can be reduced, right? So if you take a fall and fracture a hip, that can be really detrimental to you, right? So it's very important that we work on balance and we put a significant focus on that here in our exercise clinic. All right, so measuring aerobic exercise intensity. We're gonna cover a couple areas here. We have the moderate intensity and then we have the vigorous intensity zone. I'm gonna backtrack here a little bit. When it comes to exercise, we kind of go through this phase, all right, or exercise continuum, I like calling it. We start with a warm-up, okay? You wanna just get the body going before actual exercise. Think of it as like a cold car on a cold day. You don't want to just start it and start driving, right? You're going to eventually ruin that engine. So same with the body. You want to gradually warm the muscles up to avoid injury, slowly increase heart rate, slowly increase breathing rate and blood pressure so that you can prep the body for the harder exercise that's about to come. After we finish the warm up, we need to get into a zone where we're actually pushing ourselves a little bit more. If you stay in that light zone the entire time, we're not going to see any benefits. The first zone we promote to patients is trying to get into this moderate zone. When you exercise, can you have a conversation with someone? If the answer is yes, great, you're in the moderate zone. If you can still easily whistle or sing a song, it's too light for you. You can push yourself a little bit harder. RPE, rating of perceived exertion. This is basically a self-perceived scale that tells us, or tells you rather, how hard exercise feels for you. Okay, so I know it's a little bit hard to see there, but 0 to 2 is considered easy. Easy means you can whistle or sing a song. 3 to 5 is defined as moderate. Moderate means you can talk, but you can no longer whistle or sing. And 6 to 10 is defined as hard. Hard means you can no longer talk. Those are the 3 different avenues we look at. When you're doing moderate style exercise, you should be able to have a conversation, right? If you can, again, still whistle or sing, it's too easy. You can push yourself a little bit harder. Now, the last point here is heart rate targets, okay? So I have had individuals come up to me, well, Nick, for my age, what's a good target heart rate for me to be working at? To be quite honest with you, the best way to get this answer is going to be through something known as a stress test. Okay, some of you might have had that before. We get you into a lab, we hook you up to an ECG, monitor your blood pressure, have your heart rhythm being monitored, and then we get you on a treadmill. Gradually, the incline and the speed of the treadmill go up, and we have you go until you can't walk anymore. Okay, and that gives us a good idea of what your maximum output can be. Now, obviously, we don't have the luxury of that here in this clinic. So another way we can use it is the formula 220 minus age. Okay, so I like using a 20-year-old just for simplicity's sake. So let's say 220 minus 20, you get 200. You take that 200, you multiply it by 0.5, you get a percentage. You take that 200, you multiply it by 0.7, you get a percentage. Okay, so that gives you a bit of a range. There's a few reasons why I don't like this. One of them is if you're on a medication that slows down heart rate, like a beta blocker. Because you're on this medication, it won't even apply to you because your heart rate's going to be very suppressed. If you're someone that's really deconditioned, right? Someone that doesn't exercise a whole lot, your heart rate's going to go up very quickly with minimal exercise. It won't really apply to you. On the other end, if you're someone that's very conditioned, very used to exercise for your age, your heart rate target's going to be much lower, right? You're going to try to get your heart rate up, but because your heart's so conditioned, you're not going to see it jump up too quickly. So instead, I like going off of the talk test and the RPE scale as primary markers of intensity. And on the other end, we have vigorous intensity. Okay, so using that same talk test, you cannot say more than a few words, right? If not talk at all. So think about that intensity. Think about the last time you were only able to say a couple words when exercise. Well, it's a lot harder to manage. In terms of the RPE, you're at a 7 to 8 out of 10, so much higher on the scale. And for a heart rate range, 70 to 85% of your maximum. So typically speaking, coming to the clinic, I get patients, especially if you're brand new to exercise, we're going to start you in the moderate zone, right? Much easier to maintain. You can sustain it. We'll slowly start dabbling into the vigorous zone. If you're someone that's very conditioned, you've been exercising for years, you feel comfortable, then yeah, we'll start pushing you more so into the vigorous zone. But each, does have its benefits. And there are times that I do want to slowly start to promote a little bit more vigorous without necessarily having to have an individual stay in that zone. Okay, and so that's what we'll see here. If we want to try vigorous training exercise, there's something known as HIIT training, or high intensity interval training. And so this is short periods of very high intensity movement followed by short periods of rest. Okay, it's safe, it's time efficient, and it's been shown to have many great benefits, not only on body composition, blood sugar levels, helping to regulate blood pressure a little bit better. And so in prostate cancer patients undergoing radiation therapy, a short-term participation in HIIT training has been shown to help with some of the fatigue that these patients feel. What's an example here? Well, you can start pretty light here. Start with maybe a 15-second pace where you're going fast. Fast is defined again as maybe you can only say a couple words, followed by 45 seconds of slow recovery. Slow in terms of, okay, now I can whistle or sing a song as I recover. And you do that for a total of 4 minutes. And then after that, maybe you bump it up to 20 seconds fast, 40 seconds slow, and then eventually 30 seconds fast, 30 seconds slow. Our goal, we want to work up to a minute ratio, a minute fast, a minute slow. These numbers are very arbitrary. Maybe you're someone that has to start with 5 seconds fast and 1 minute slow, or 10 seconds fast and 45 seconds slow. That's completely fine. There's always room to improve. And so if that's your starting point, that totally works. And then we can gradually start to develop off of wherever your starting point is. Another area that we do want to put a significant emphasis on is balance. I talked a little bit about this earlier, but we know that treatment side effects can influence balance, as well as your risk of falls, which for patients that have reduced bone density can be a little bit more detrimental to health because of fracture risk. Balance and functional training, in addition to other types of activity, are also recommended to help reduce fall risk. What are some things we can do here? Well, there's an app you can download, Clock Yourself, a very unique app. You follow along with some of the exercises there, and it's a great way not only to train brain health, but also using your brain and doing coordination. Something as simple as standing on one foot and moving your arms in different directions. Maybe standing on a pillow and shifting your weight side to side. This starts to train a little bit more of your ankle mobility. And the perception, you'll be surprised at how much balance training you can get by just simply, even if I'm standing on both feet and just closing my eyes, you'll start to be like, oh, you might even sway or might fall over, right? If you're not used to that. So a lot of great ways where we can train this. And if you have any questions, this is something that you can work with us in the clinic on and get a proper program prescribed for you. Is it safe? It needs to be, you need to kind of feel wobbly, right? Slightly unsteady. Like when we're on our feet, you feel very confident, right? As soon as you lift one foot, you might start to feel a little bit of shakiness come on, and that's okay. As long as, you have support around you, maybe a wall nearby or a chair, so that you don't have a fall. And so as long as you cover these risks, we can gradually progress you as we move along with the balance program. Now this here basically summarizes that point I was talking about earlier between the 3 different segments of exercise we go through. So we go through the warm-up stage, which is light, right? Then it's followed by conditioning, and then we finish off with a cool down. And the cool down is important because you want to slowly bring everything back down to baseline, right? You don't want to just finish a hard run or a hard cycle and then go sit down in a chair. Blood's going to start pulling your legs, and you potentially might start to feel dizzy or lightheaded. So it's very important during the cool down, you maintain a slow, steady walk again, similar to what you did for the warm up. It's supposed to be very light and easy. Cool down is also a great time to perform some stretching. If we go through this exercise continuum, not only will this be the most effective, but it will also help to ensure that we can significantly reduce our chances of having any sort of injuries occur. Why do we do aerobic exercise? Well, we know that research shows that exercise can increase long-term survival. All types of exercise and physical activity enhance survival rates by up to 58%. Doing some vigorous exercise each week further lowers risk of death from prostate cancer. This last point is quite a big one. So increased aerobic fitness slowed prostate cancer progression, as shown by increased PSA doubling time, because that's something that your oncologist is looking at quite significantly, or consistently rather. And so we know that performing aerobic exercise has been shown to increase that PSA doubling time, so the amount of time it takes for that number to go up, right? And so if we can stay consistent with this, then it can have a positive impact on that PSA number or value. Ask yourself, how much exercise are you currently doing, and what can you start doing today, right now? So this would actually be a great time for us to do a movement snack. If you haven't already done so, I'll give you a quick second, maybe do 5 sit to stands right now. Maybe go over to a wall, you do your 10 push-ups. Maybe if you have to go quickly use the bathroom. But again, I just want to start getting this into your head that, hey, these aren't having to be super challenging movements, but at least this is a way where I can start promoting these bits of movements throughout the day so they can have a bit more of a positive impact on my health. Next, what we're going to do is talk about resistance training. We know that resistance training is measured by sets, reps, and load. Okay, so some terms you might have seen before, but I'm going to define each of them. So let's say I'm doing a overhead press exercise. I have 2 weights in my hand, and I press it straight above my head, and I lower it back down. Okay, up, down. Each weight in my hand is 10 pounds, and I'm going to do this movement 10 times. Okay, I do my 10, I put it down. So I just did 10 repetitions. I'm taking a minute break. I pick those weights back up. I'm going to do another 10. Okay? Put them back down. So I just did 2 sets of 10 repetitions. Okay? After a minute, I come back. I do my 3rd set of 10 repetitions. So repetitions is how many times you perform the movement. Sets is the group of repetitions that you perform. So in this example, it would be 3 sets. And load is how much weight you're using. Okay? So in this example, we use 10-pound dumbbells. So again, sets is the group of repetitions you perform. Reps is how many times you perform the movement, and load is the actual weight using. So in this case, it was 10 pounds, but it could even be your body weight as your load. It's recommended that you build up to at least 2 to 4 sets of 8 to 12 repetitions, and you know that you're using the correct weight if at the end of the set you cannot perform any more reps. For example, let's say you come in and you chat with me. The goal is 3 sets of 10 repetitions. Okay, so you grab your dumbbells, you're doing your bicep curls, 8, 9, 10, you're going for 11. Oh, you can't do it. You drop the weight. Okay, good. Second set, 9, 10, you're going for 11 again. You're done. Third set, same thing. So you got exactly to 10. Perfect. That's what we're aiming for. But on the other hand, let's say you went 10, 11, 12. Oh, 13. Good. Okay, put it down. Second set, 11, 12, 13. If you're above the desired rep range for 2 consecutive sets, it's showing me that the weight is too light. So that's a sign for you. You can probably go up by a couple pounds. On the other end, same thing. Let's say you're at 6. Ooh, I can't get to 7. Or 6, 7. Ooh, I can't get to 8. If the goal again was 10 and you're only able to do 6 or 7 or 8, too heavy for you. Okay, so that's a sign that you need to reduce your weight at that point. In terms of tempo, very important, right? We don't want to be swinging the weight. We don't want to be moving our arms all over the place. 2 for 2 is the rule I like using. So 2 seconds as we come up, 2 seconds as we lower back down. Same thing with like an overhead press, right? 2 seconds as we come up, 2 seconds as we lower back down. Squat, 2 seconds down, 2 seconds back up. Okay? If you follow that, then generally speaking, you'll be slow enough where you're getting the muscle activation, but not fast enough where you're using momentum. Full range of motion, this is a big one, right? If we're going to be dedicating this much time to exercise, we want to make sure that we are performing it correctly, right? So if this is a full bicep curl and I'm only doing this much, I'm not recruiting all the muscle fibers. Same thing with this shoulder press, right? If this is full range of motion and I'm just going to here, not getting the full range. Again, obviously there might be some modifications here if you have a shoulder injury, arm injury, back injury, but we want to get the full range because we want to get that full recruitment of the muscle tissue and fibers so that we can get maximal strength and maximal muscle gains in terms of hypertrophy or muscle size. So again, full range in the exercise clinic. We'll be able to go over that with you as well. Taking breaks in between sets. I know a lot of us are pretty strapped for time, so you like just going through the routine super quickly. But the problem is if we do that, your nervous system and your endocrine system both need time to recover before doing the next set. So if you think about it, you just did 10 reps to failure basically on that 10th rep. It's going to be hard for you to go right away and pick up that weight and do 10 more because you've just fatigued your muscle. So you do need to give yourself at least a minute break in between sets. The heavier you go, you need up to a minute and 15 or 30 seconds. The lighter you go, right? If you're doing 15 reps, maybe even upwards of 20, then you might be able to get away with like a 45-second break, 30 to 45 seconds, okay? So it's going to really depend, but make sure you do take breaks in between those sets. And lastly, remembering to breathe. This is a big one. I know it seems like common sense, but a lot of us forget to do this, especially when we're lifting in the gym. So breathing. I don't care how you breathe to start, just breathe. We don't want to see your face going red, especially if you have hypertension or high blood pressure, setting your blood pressure through the roof. So ideally just breathe. But if you do want to get into the pattern, on the concentric or the working phase, you want to be breathing out. On the eccentric or the recovery phase, you want to be breathing in. So for example, when I'm lifting the weight above my head, that's the working phase, right? I'm breathing out. I'm working to push it above my head. On the down phase, recovery, I'm breathing in. Bicep curl, I'm working to get this weight up. So that's my breathing out. And then as I lower down, I'm breathing in. Okay, squat, I'm coming down recovery, as I come out of the chair or out of the squat, that's when I'm pushing and using the muscles. That's when I'm going to be breathing out. So again, breathing in as I'm coming down, breathing out as I stand up. In terms of resistance training exercises, these are just a few examples of things you can try at home. One thing I want to get across, especially here in the clinic, is we have many individuals, many men coming through that feel a little bit hesitant. They've never gone to a gym, never exercised, and they're like, okay, well, Nick, a lot of this stuff I might not be able to do. So we have men on that end, and then we have gentlemen coming in that have exercised for many years. So and everything in between. Okay, so there is always exercise modifications that we can do for you. So for example, this first exercise, the chair squat, you may have to start in a chair and push off with the armrest, right? That's totally fine. Do 10 of those. And then eventually, maybe you don't have to use the arm, maybe push off with your legs, and then arms across. Now you're not using anything at all. And then eventually, maybe you push the chair back and only your bum touches, and then you're doing air squats. Okay, same thing with the push-up. If you're a beginner, I'm not going to be like, get on the ground and do 10 push-ups. It's start on a wall, maybe gradually move your feet back more, so it becomes more challenging. From a wall, we go to a table, 10 push-ups, and then from a table, now we go to the ground, but off of the knees first, and then we do push-ups off of the feet. Okay, and then lastly, planks. So planks, again, I'm not going to start you on the ground. Maybe we start on a wall, and then down on a chair, and then finally we do a plank down on the wall, on the ground rather. Okay, again, maybe starting off the knees and then using your toes as a pivot point. So just know there's always ways you can modify. And we didn't even talk about injuries. Many men or many gentlemen I work with are dealing with some sort of a musculoskeletal ailment, right? So if we can always add in or modify exercises so that it's not as challenging for you. Now, I always joke about this, right? This is not the goal, right? In our 20s, yes, it was cool. Maybe to just have mounds and mounds of muscles. But now, especially in our later years, the goal is functionality. Okay, I couldn't stress this enough. When we take a lot of the stuff, especially when it comes to our body, for granted until we lose functionality, right? Maybe until an injury pops up, maybe until you're going through certain treatments. But our goal should be, the older we get, we want to maintain that sense of independence, especially as men, right? We want to be able to carry our own groceries. We want to be able to play with our kids or grandkids. You want to be able to go upstairs, get out of a chair without necessarily having to rely on someone else or an aid. Exercise is absolutely going to be able to help with that. The statement holds true. If you don't use it, you lose it, all right? And if we're able to be consistent with it, it doesn't have to be anything special, but just go through these continuous routines on a week-to-week basis and incorporate that into your lifestyle, just like brushing your teeth, right? If we can make this a habit, then long-term, hopefully you're living up to 70, 80, 90 years old, 100 years old even. The goal is to improve and increase that quality of life, right? Because there's no worse feeling than having to rely on other people or other aids to function on a day-to-day basis. So what about power, right? We didn't touch on this a whole lot, but power basically is your ability to move things quickly. Okay, so we know that we use fast twitch muscle fibers to produce force quickly, such as during brisk walking, reacting when we're off balance, and up and down stairs, and just everyday activities, right? An example I like using is, let's say you're out for a walk and you slip, okay? In order to catch yourself, you need to have quick reflexes to get your other foot out or your hand down to prevent you from having a full fall and significant injury, all right? So there's different power drills we can do to activate these fast twitch muscle fibers in order to do that. So we know with the aging process, however, that we see a reduction, unfortunately, in these muscle fiber types, which means you start to slow down a little bit more. And by adding speed when we lift weights, we can actually target these muscles rather, so that we can prevent the slowdown of the decrease in these types of muscle fibers. Okay, so how can we do this? Well, we can lift the weights quickly and lower the weight slowly. And so power training is something that if you are looking to perform it, I would advise for you to speak with a exercise physiologist, just because it is a little bit more advanced and there are certain aspects that we want to talk to you about before first starting this, but it can be very important and very beneficial, especially as we age and start to see a decline in these fast twitch muscle fibers. So what I want to move into now is specific exercise prescriptions to manage and reduce treatment side effects. Now, the first one we're going to talk about is urinary incontinence. Research shows that the pelvic floor, or the Kegel exercise, improves the condition of the muscular sling, thus improving control and function of the bladder. So we know, especially with patients that have undergone prostatectomies, had their prostate removed, or patients that have undergone radiation therapy, they may be experiencing this incontinence, right? And so one of the key things that we know we can do for this situation is being able to activate the pelvic floor muscle. All right, so some of the benefits include possible quicker return to continence post-surgery, meeting physical activity guidelines pre-surgery, which will lead to less incontinence post-surgery. Many of the guys I worked with that were very regular with exercise, trying to maintain a healthy weight, obviously having good nutrition, tended to have really good outcomes post-surgery when it came to incontinence or even post-radiation therapy. All right. So obviously this is outside of my area of expertise, but we have a whole module dedicated to this, the pelvic floor module. So if you are someone that's going to be going into surgery, or if you're dealing with any incontinence right now, or if you are planning on having radiation therapy done, it's always nice to have that knowledge base. So I would highly recommend you attend that education session. And if you still have questions or concerns after that, or you're dealing with incontinence, then potentially booking in with one of our pelvic floor physios would be beneficial for you. It is estimated that over 80% of cancer patients experience fatigue at some point. If you adopt a rest strategy, you will increase your fatigue levels. Okay, so we talked about this earlier. Remember that example with Sarah and Mike? The more you rest throughout the day, your fatigue actually gets worse. And you might be like, well, Nick, that's kind of contrary to kind of popular belief here, right? When you're tired and you want to rest, you just kind of want to just do nothing and you feel like you recover and go on with it once your energy levels come back up, right? And actually that couldn't be further from the truth. So if we go back to what we talked about earlier, if you're like, oh, I'm tired from this radiation therapy, I just want to lay in bed all day, your body is going to adapt to that again, right? So muscle mass is going to reduce much quicker, weight gain is going to increase much faster. We're talking about metabolism reducing even more, and you'll just feel a lot more lethargic throughout the day, right? And so I'm not saying on days you do radiation therapy or have hormone treatment or you just feel really tired, you got to go for an hour walk. But even just adding in those small bits of movement throughout the day are very helpful, okay? And so maybe it can be, instead of going for an hour walk today, maybe I'm only going for a 30-minute walk today, all right? Maybe instead of even going for a walk, every hour I'm just going to get up and walk around my house for a few minutes, okay? If it's really bad and you're bedridden, maybe it's just a matter of, okay, I'm going to sit up on the side of my bed, sit down and stand up 5 times every hour, and then go back into my bed. It can be something as simple as that. Okay, so we know that aerobic and resistance exercises have been shown to be the most effective management strategy for fatigue when correctly prescribed, and even more efficient than medication. All right, and so to enhance energy, exercise daily in manageable doses and build your volume up slowly. So another thing we know about energy levels, as the day goes on, energy levels do start to decrease. So I recommend, if we can get exercise in earlier in the day, it'd be a little bit easier to tolerate. So what are some of the suggestions we have then for mitigating fatigue? So I just brought up that example, exercising earlier in the day versus at night. Break the exercise into smaller bouts. So instead of doing the big 30-minute walk at once, maybe it's a matter of doing it 3 times 10-minute bouts. Reduce walk time for the day. Instead of 60 minutes, like I mentioned earlier, you take that down to maybe a 20-30-minute walk that day. Try getting up every hour, go for a walk around your home maybe. That way you get some blood flow going, boost the metabolism a little bit, and take exercise breaks, right? We mentioned this earlier. So TV show, you're watching a commercial, pops up, and boom, just go ahead, 10 sit to stands, or maybe even going to a wall and doing some push-ups. So there is a time and place where you potentially might be doing too much. Okay, so let's say, for example, Monday you did the exercise routine. You wake up Tuesday morning, a little bit sore, you can still function and do your day-to-day activities. Wednesday, maybe a little bit more sore, but again, you can still do your activities of daily living. By Thursday, you're feeling good, you're ready to do that exercise program again. Same example, let's say Monday, you did the exercise routine. Right after the routine, you're bedridden. Okay, you can't move. Day after that, can't move, you can't do your day of activities of daily living. And this happens for 3-4 days after your routine. If that's the case, you did too much, right? And in that situation, you need to chat with your clinical exercise physiologist or trainer to kind of rejuggle your program so that we're not experiencing that type of soreness. Okay, so if your soreness for 1 or 2 days after your routine is considered normal, if you're sore and you can't do your activities of daily living for 3, 4, 5 days after your actual exercise routine, or you can't even walk the day of the routine, then again, you did too much, and that's when you should be talking to your exercise professional for a little bit more support. Exercise and hormone treatment, right? We know that exercise can help with body composition changes. Now, ADT increases in body fat, approximately 10%, and reduction in muscle mass by approximately 4% during the initial 12 months. So we know that ADT, androgen deprivation therapy, is a treatment that's used to reduce the progression of prostate cancer. And it does this by taking a man's testosterone and dropping it to 0. Okay, so you can imagine how this will have a very significant impact. No testosterone in the in the male body, rather. We're going to see a potential or significant reduction in muscle mass. We're going to see a potential increase in weight gain, hot flashes, fatigue, a lot of different things that come on with it. But I want to make a key point here. Muscle mass, right? We talked about that earlier. Remember how we said as we get older, muscle mass naturally declines? Well, you take that natural decline in muscle mass as we get older, you add on being on this hormone treatment, you're going to almost amplify that, right? And so one of the key features with patients that are on hormone therapy is to try to perform resistance training. This is going to be a gold standard. We want to retain as much muscle mass as we can. And by performing resistance training, we'll be able to do that. Men with prostate cancer who are obese or develop obesity as a result of androgen suppression, reduced physical activity, or even stressful eating are at risk of increased severity of treatment-related side effects. So some of those points we brought up earlier, weight gain, fatigue, hot flashes, can be made worse with patients that are on this hormone treatment. And so reduction of muscle mass can also help reduce musculoskeletal fitness and compromise your strength, which we talked about a little bit. And we know that exercise, especially resistance training, can help preserve this lean muscle mass. Okay, so a little bit earlier, we talked about how reps and sets are very important. With patients that are on hormone therapy, generally speaking, I get them to lift on the heavier side, right? So we went 8 to 12 reps. I'm going to work you down to probably 8 repetitions, all right? So that means you're failing on the 8th rep. So you're lifting quite heavily. And so this is the reason for this is there's a lot of research coming out of Australia that a cohort of men go through this protocol of 8 repetitions for multiple sets. And over the period of time, they found that they were actually able to maintain their strength, okay? And so if you're someone that's brand new, I'm not going to start you off with 8 repetitions, right? That's just setting you up for failure, potential injury. So we'll start off light, maybe 12, 15 repetitions, get used to the movement, add a bit of weight on, then get you down to 12 reps, 10 reps, and then eventually down to the 8 rep zone, okay? So it's something that we can absolutely build up towards. And this is something, if you're interested, we can talk about more in the clinic. Now, exercise and minimizing bone loss. We know that osteoporosis is a loss of bone tissue leading to brittle and fragile bones. Okay, so a reduction in bone mass leads to an increased risk of fracture and associated disability. Bone density is lower for men on ADT and reduces the longer ADT treatment goes on. And men with prostate cancer who are receiving ADT can actually safely perform exercise to help preserve some of that bone strength and function. Now on the left there, you can see what a normal bone matrix looks like. And on the right there, you see a lot of these porous holes, which develops for patients that have osteoporosis. The longer term an individual stays on ADT treatment, the higher the risk of potentially developing osteoporosis. And we talked about this earlier. You take a fall, you fracture a hip, that can be quite detrimental to your health, right? So we really want to focus on building bone strength, especially with the patients that are on hormone treatment. And so aerobic resistance and impact exercises can help to build bone mass, improve bone structure, as well as reduce bone loss and prevent falls, okay? Now you might be asking, well, Nick, what is impact exercises? So you can think of this as like a skipping rope, any sort of hopping exercises, jumping up and off of a box, even something as simple as marching on the spot to start, even something even simpler than that, coming up on your toes and dropping down to your heels while holding a chair. All these different exercises have an impact on the long bones of your legs. And by doing them repetitively over a period of time, it will slowly start to build up strength. Now, before doing any impact exercises, though, I do recommend speaking with an exercise professional, like an exercise physiologist, because we don't know your history, right? If you have really weak bones from a bone mineral density scan, we don't want to give you a hard impact exercise to start with, right? Maybe we have to build up to that to prevent any sort of fracture risk, okay? So if you are interested in any of these exercises, again, you're more than welcome to book in with an exercise physiologist in the clinic. Now, exercise can help with sexual health as well as libido. So sexual activity and libido will normally decrease post-surgery and during and after ADT. Studies show that a 3-month group-based resistance training and aerobic program can maintain sexual activity, increasing libido, as well as increasing feelings of masculinity. And resistance and aerobic exercise at moderate to high intensities, which has shown some efficacy in patients receiving ADT, may also have an indirect effect on sexual health and well-being. Am I saying by lifting weights, you're going to be able to go out, get your libido back, improve your erectile dysfunction? No, I'm not saying that, right? But what I am saying is there is some literature starting to come out now where it's just something about a guy getting in a gym or at home lifting weights that's starting to show that there's a bit of an impact there. Again, if you're really struggling with sexual health, I would highly recommend speaking with our sexual health clinician. So we have a few nurses that we work with here. They can go through it with you. You can choose to bring your partner as well. And you're more than welcome to book in on that. A couple other side effects when it comes to hormone treatment potentially can be hot flashes. 80% of patients on ADT experience hot flashes. We do have a whole module dedicated to this again. So if you are experiencing any of the side effects of ADT treatment, I would highly recommend going to the ADT module, because they can sit down with you and work with you on ways to combat some of those side effects. Mental health. So we know that men will experience decreased mental health is common in prostate cancer patients, and most patients will experience changes in quality of life. You're going through a lot of new things here, right? You might be experiencing incontinence for the first time, a lot of fatigue for someone that's been, working and having all this high energy all the time. You're noticing weight gain, you're noticing muscle loss, right? This can be overwhelming. And, the worst thing as men that we end up doing is, we don't want to talk about our problems. We want to internalize it, which couldn't be further from the truth, right? Maybe your friends, your family are trying to help out, but they just don't understand, right? So it's nice to sit down with a qualified professional like a counselor, work through some of these problems, and instead of internalizing it and increasing your stress and anxiety, getting it out there and working through plans on managing some of that stress. We have a counselor in our program, and it would be more than useful if this is something that you wanted to do, to book in with them and have a consultation and see if it's helpful for you. We know that bone metastases and advanced cancer, exercise can be safe when correctly prescribed in this demographic, but I would much rather you come into the clinic and chat with you, because there are a couple assessments and questions that I want to ask you. Are there movements that cause pain or discomfort? And if there are, then we need to make sure that we're providing modifications and not making that any worse. Okay, certain patients may be experiencing peripheral neuropathy. This can occur after chemotherapy. This is loss of sensation potentially in the hands and feet, more commonly in the feet. Loss of sensation in the feet can lead to potential fall risk. Okay, and so if you're experiencing that, maybe talk with your doctor. There are a couple balance exercises we can work on, but more of an issue to bring up with your physician. And lastly, lymphedema. So this can occur after lymph node removal and radiation. This is essentially swelling in your limbs, more commonly in the legs. So if you're noticing this, your doctor may prescribe you to use compression stockings, maybe elevate your legs. In certain situations, you might be prescribed like a diuretic. But again, if you're experiencing any of this, bring that up with your physician. One thing I also wanted to bring up, if you are experiencing issues again with weight gain, it wouldn't be a bad idea potentially to also speak with our program dietitian, right? We have a whole module dedicated to nutrition, but a lot of these different treatments can potentially have an impact on weight if you're not able to move as much or you're not as mobile. Working on nutrition is huge, because that's more than half the battle when it comes to weight. Considering checking out the education talk for that, and if you do have questions, you can always book in with the dietitian here in our program. Okay, so we want to choose exercise that will specifically reduce and manage the side effects of your treatments and prostate cancer treatments, as well as response to treatments, right? And so the more we can be methodical about the exercise we're doing, the more benefits that we're going to see long term. Now, getting started, we're going to dive through each of these sections here. Safety, goals, barriers, as well as support. So safety, again, you did this education talk with me. I don't specifically know you, right? So I can't just be like, go off and start exercising. Always get that clearance from your physician. If you don't plan on talking with an exercise professional, and if they give you the green light, then by all means, go ahead and start. Post-surgery treatment, when is it safe to start? So here we're talking about having a prostatectomy. You're going to be on a 6-week window where you aren't able to do heavy lifting or lift anything heavy or do any sort of resistance training, rather. They usually limit it to mainly just walking. And so once the catheter comes out, I always recommend patients do some light walking around their home. Maybe after about a week, you can start going for a walk outdoors, light walks, maybe 10 minutes at a time, and see how you feel, right? Go through a checklist. How do I feel during, right after the walk, and the next day when I wake up, right? Do you notice any increases in discomfort or pain, right? Is there significant increases in incontinence, right? If you answer yes to that during, after, the next day, then you know you might have done too much, right? If you answer no to all those and it's been a few days, okay, maybe 10 minutes becomes 12 minutes, and then 12 becomes 15. And then over time, we can gradually add a little bit more intensity on. But again, this is something nice to talk with your exercise physiologist about. Always include a warm-up and a cool-down that incorporates mild stretching and aerobic exercises. And start slowly and build slowly to avoid doing harm, right? we don't want to jump the gun too quickly. As men, we let our egos get in the way sometimes, right? So you don't want to just go, oh, this 10-pound weight is easy, I'm going to jump right to 20 pounds, right? That's setting yourself up for disaster. Maybe it goes 10 pounds. I did 2 sets of 10. Okay, now I'm ready for 3 sets of 10, or 2 sets becomes of 10 becomes 2 sets of 12. And then 3 sets of 10 becomes 3 sets of 12. Okay, I feel good. Now we go from 10 pounds to 12 pounds. Okay. Same thing with if you're on an exercise piece of equipment. If you're on a bike, you're on level 5. Now it's not like, oh, level 5 is easy, I'm going to go to level 10, right? Maybe it's level 5, maintaining a 60 RPM. Oh, I can easily go up to 70, 80, no problem now. Level 5 now becomes level 6 at 60 RPM. The recommendation number 4 is speaking with consulting with a qualified exercise professional to safely guide you through exercises suitable for you and your situations. We have governing bodies here through the Canadian Society of Exercise Physiologists, Exercise Medicine Canada, American College of Sports Medicine, and Physiotherapy Association of BC. So if you're working with any professionals with these accreditations, you know that they have a good background to work with prostate cancer patients. Can you go off and work with a trainer? Yes. But the only issue that potentially may arise is, okay, well, you're back after surgery and the trainer has you doing some stuff for your core to get your stomach strength good. And you're all of a sudden like, oh, I feel a bit of discomfort and it's getting a little bit worse. And your trainer's like, no, that's fine. That's just, lack of musculature. When really you're doing some damage there after the surgery. That's not their fault, right? They're not trained to work with the chronic disease population. And so what I'd rather recommend, come in, speak with one of our exercise professionals here in the clinic, or maybe one in the community, and at least get a guidance on what you should and should not be doing. And then using that information, you take that to your trainer, your kinesiologist, and then they can follow those guidelines to work on preventing injury. Goal setting. So when it comes to goals, we here in the clinic, we spend a good time identifying goals and any potential exercise barriers, okay? Because we know that barriers are going to come up with exercise, and we want to be able to combat them when they do. A lot of this stuff is discussed, and setting goals is going to be something that we want to go over with you so that we can, work towards something while we're working with you over the course of the year in the clinic. We like saying what's known as SMART goals. It's an acronym: specific, measurable, action-oriented, realistic, and timely. So specific, what do you want to do? Let's say a general goal I see a lot is losing weight. Okay, I want to lose weight. Perfect. Measurable. Okay, how much weight do you want to lose? Okay, let's say about 10 pounds. Okay, good. Action-oriented, how are you going to do it? Well, I want to go to the gym. I'm going to go 3 times a week for 1 hour. 30 minutes I'm going to spend doing cardio. 30 minutes I'm going to spend doing strength training. Okay, good. Realistic. Is 10 pounds realistic for you? In what time frame? 10 pounds in a week? No, that's not realistic. 10 pounds in 2-3 months? Yeah, a little bit more realistic, right? Do you, and then in terms of your action plan, do you see yourself going to the gym 3 times a week, right? What if, your friend calls you up and says, hey, let's go for a happy hour on Friday, and that's your gym day, right? Do you have a backup plan? Maybe you got to pick up one of your grandchildren that day. Timely. When do you want to have this goal achieved by? You're trying to lose weight, again, like I mentioned, in a week, or in a couple months. Realistically, we're going to try to lose 1 pound to 2 pounds a week over the course of a month. That's 2 to 4 pounds roughly. Over 2 months, that can be upwards of 8 pounds. Okay, so it would be more realistic goals to say you want to lose that 10 pounds in a period of 2 to 3 months. So we just took this goal of I want to lose weight to I want to lose weight. Specifically, I want to lose 10 pounds in a period of 3 months, and I'm going to do it by going to the gym 3 times a week. Monday, Wednesday, Friday, 30 minutes I'm dedicating to cardio, 30 minutes I'm dedicating to strength training. If I can't go during the week, Saturday is my buffer day so that I can make up for any day that I missed during the week. We take a goal that was very general, we specify it, and it becomes a lot easier to achieve. Next steps. We've had this discussion today. If you feel like you got the information you needed, great. If you do want to book with me, we're going to have some information here at the end so you can contact our clinic to book an assessment appointment. Cardiac rehab. So for patients on ADT at risk of cardiovascular disease, we may be able to refer you to a cardiac rehab program if we're having a consultation with myself and my colleague, and we notice that there's some significant risk factors: high blood pressure, high blood sugar, maybe high cholesterol, obesity, metabolic disease. We may feel that it's more suitable for you to go to a cardiac rehab program, okay? We're going to refer you over there. Local community programs and companies, so group exercise classes for prostate cancer patients, which we're going to talk about in a second, prostate cancer, dragon boat teams, local exercise professionals, support groups. So there's a lot of great things out in the community. Contact our clinic if you want more information. HealthLink BC, calling 811. You might have remembered this from the pandemic, calling this number if you're concerned about COVID and whether or not you should go to the hospital. We also have many health clinicians on this line. We have dietitians, nurses, we have exercise professionals now. specifically exercise physiologists that are trained to work with prostate cancer patients. If you have a question and you can't get in touch with an exercise professional at the time, call this number and they can answer any questions that you might have. And lastly, research studies. Our clinic does take a good initiative on research. You got to remember that a lot of the research that was done 15, 20 years ago is what's allowing us to adapt and help so many patients today, right? So you may be presented with the opportunity to be involved in a research study. If you want to, great. If you don't want to, then that's not a problem either. I mentioned this group exercise earlier. So we have a program known as the Survivor Program. It's a 6 to 12 week exercise program consisting of 2 1-hour sessions each week. It's designed to support men who have been diagnosed with prostate cancer and engaging in regular exercise. It focuses on strength development through resistance training, cardiovascular health exercises, as well as balance and flexibility, all the pillars we talked about today. And it's delivered by the BC Parks and Rec either in person or you can do it over Zoom. So there's a few reasons I like a program like this. One, you get to work with an instructor. Okay, so this instructor you work with designs your program. They've been trained to work with prostate cancer patients. Okay, they are able to modify you on the spot. So if there's something that you're not performing correctly, they'll be able to let you know. And they hold you accountable, right? If you don't show up, they'll give you a call. Hey, where are you? So-and-so. And they essentially make sure you show up and you stay consistent with your program. The other main aspect I like is you work with other prostate cancer patients in this group. You're all going through it together, all working together, motivating each other. And a lot of the times, there's some great connections here. Gentlemen will end up going out for lunch, maybe grabbing some food after, and even sharing some of their stories on some of the treatments that they've gone through. So something great to consider. Again, if there's not a physical location near you, you can always do an exercise class like this over Zoom. If you do need any more information, you can always contact our clinic, or we do have the link that you can check out the website for that. To summarize, I just wanted to go through these 4 pillars again. So with aerobic exercise, we know that we want to aim for most days of the week. Okay, at an RPE where you can at least talk, no longer sing or whistle. Ideally aim for 30 minutes a day. You can do more if you want to. This can be broken down to 10-minute sessions. To accumulate that 30 minutes a day, it can be 30 straight. It can be more than 30 minutes. Okay. Whatever activity you enjoy, whether it's walking, whether it's running, cycling, swimming, as long as it's continuous for at least that 10-minute period or more. Resistance training, frequency at least twice a week. We want to be focusing on 8 to 10 exercises for the major muscles of the body, 2 to 4 sets of 8 to 12 repetitions. Now, remember to add in that rest period too for proper recovery. Depending on how many reps and sets you do, routines can be anywhere from 15 to 45 minutes. And this can include body weight, dumbbells, resistance bands, anything that you have access to. Flexibility. We want to focus on doing this on days you perform exercise, so essentially most days of the week. Okay, it should be RPE light, so it shouldn't be challenging, you shouldn't be breaking a sweat here, and it should be mild stretch, so pain-free. If you're feeling pain, you're probably pushing too hard into the stretch, ease up a little bit. Time, usually about 10 to 15 minutes. This can be a full body stretch routine. This can be yoga. You can follow some routines online. And then lastly, balance, okay? So ideally 1 to 2 times a week, you want to include more frequency. Again, if you're over the age of 65, have osteoporosis, or your balance is poor, but essentially everyone should be doing some sort of balance exercise, okay, on a week-to-week basis. Again, intensity should be RPE 2 or light, shouldn't be strenuous. We want to spend at least 10 to 15 minutes doing it. And the types of exercise include single leg, heel to toe, Bosu ball, standing on a pillow, standing on one leg. Again, you can shift your weight side to side on that pillow. Anything that's going to promote a little bit of that unsteadiness, or you feeling a bit of that wobble, to really train your body's awareness to stabilize you. Okay, at the end of the day, we want to promote moving more and sitting less. Now at this point, if you are planning on coming into the clinic, you can reach out. I'm going to give you some information here on this last slide actually. So you can reach out to our program coordinator. Her name is Judy. Talk to her with any questions you have regarding our clinic or any of the other modules. She can give you information. And it's been great being able to chat today about exercise. Hopefully I get to meet many of you in the clinic. And until then, enjoy the rest of your day.